What can reduce breast milk supply? 1. Feeling stressed or anxious. Stress is the #1 killer of breast milk supply, especially in the first few weeks after delivery. Between lack of sleep and adjusting to the baby's schedule, rising levels of certain hormones such as cortisol can dramatically reduce your milk supply. I've seen women who, within 24 hours, have gone from having an ample milk supply to literally none due to stress. The last few years living through the COVID-19 pandemic have certainly increased anxiety for many pregnant women and families with young children. Adding the supply chain issues and reduced manufacturing of formula can take its toll on a woman's stress and anxiety levels. I tell all my patients that while breastfeeding is important, mental health is key to properly caring for a baby. If you or a loved one notice that you're having symptoms of stress, anxiety, or postpartum depression, it's important to connect with your healthcare provider and get adequate care. While many new moms want to do everything themselves, I encourage you to seek and accept help from your partner, family members, and friends so you can rest, recover, and maintain an adequate milk supply for your baby. They cannot breastfeed a baby, but they can help with cooking, laundry, household chores, and running errands. 2. Supplementing with formula. After your baby is born, the breasts operate on supply and demand. Exclusively breastfeeding drives higher demand, so the breasts create more milk. However, supplementing with formula for multiple feedings every day, such as while the baby is at daycare, or releasing breast milk only when the baby wants to nurse, tells your body that it doesn't need to produce as much milk. Consequently, your supply will begin to decrease. You can counteract this by pumping at regular feeding intervals throughout the day. Pumping tells the body to continue producing, even if the baby isn't eating at that moment. Breast milk keeps well in the freezer, so pump at work if you can and store it for later use. Breast pumps come in a variety of shapes and sizes, from large electric pumps to smaller handheld options. Hands-free wearable breast pumps are a relatively new option. Battery-powered, they use integrated cups that fit inside a bra and attach to breast milk containers through small tubes. These pumps can fit discreetly under work clothes and offer a moderate suction level for pumping on the go. 3. Eating or drinking too little. It can be tempting to diet after giving birth to lose baby weight. Make sure to eat enough to replenish the 500 calories breastfeeding burns each day. Consider eating a healthy snack, such as an apple with nut butter, between meals to close the calorie gap. Adequate hydration also is important for breast milk production. The amount of liquid you put into your body affects how much breast milk you can produce. I encourage women to carry a bottle of water for themselves in their diaper bag. When my children were babies, a friend told me to drink a glass of water every time I nursed. It was an easy way to remember to drink enough, and I passed that tip along to my patients. 4. Getting sick. Just catching a virus or bug such as the flu, a cold, or a stomach virus won't decrease your milk supply. However, related symptoms such as fatigue, diarrhea, vomiting, or decreased appetite definitely can. Ask for help at home when you're sick so you can continue to make enough breast milk to nurse or pump for the baby. And be sure to get your COVID-19 vaccine. It has been proven safe and effective for pregnant and breastfeeding patients. Stress is the #1 killer of breast milk supply, especially in the first few weeks after delivery. Between lack of sleep and adjusting to the baby's schedule, rising levels of certain hormones such as cortisol can dramatically reduce your milk supply. Shivani Patel, MD.